Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
And then we'll let Dr. Simpson talk about the patient perspective, and then we can kind of talk about our shared experience with these patients and how we manage their unique clinical scenarios, and then allow all your questions to be answered.
I think that's a great idea. Thanks. So just in the last couple of slides here, thinking about just, coming back to challenges in hemophilia care, and it really changes depending on the age and the stage of patients. So birth and diagnosis, it's really kind of the parents and family coming to terms with the diagnosis, thinking about treatment choices in the early years. There's constant worrying, avoiding trauma, learning to do infusions or how to care for, your child, or teaching the children how to care for their own bleeding tendencies, and focusing on kind of the protection while supporting that early independence. Adolescence and early adulthood, it's really that growing need for independence. You want them to be, staying active and healthy and increasing activity. They want to fit in. There's always challenges with adherence, regardless of what kind of chronic illness we are tackling with this age group. And then in adult life, it's seeking, treatment that matches the needs and the situation, and life changes, and we recognize that. Increasing responsibility, always adjusting that risk benefit is important to kind of continue to reassess. And then later on, thinking about just the long-term joint damage, the comorbidities, and the decreasing activity that our aging population tends to see. And so in terms of making decisions, we really have tried to come to this shared decision-making platform with patients and caregivers and our teams, really having some input into how do we get a patient to make a decision. We've talked about all these options that are now new options here, along with a long list of previous therapies that do work, and what is right for each patient, and that really comes down to just that, each patient and what's right for them. So the shared decision making is a process where the clinicians and the patients really work together to make the best decisions from both clinical evidence that balances those risks, as well as taking into consideration what the patient prefers and what they value. And so looking at, getting information from the patient, having them share their goals, their preferences, the clinicians then sharing relevant information, the evidence, the treatment options, and then together coming to what is the best course of action for them. So a decision made today, of course, can be completely revisited and changed as life changes and the priorities change. And we expect that to continue to evolve. And so this is just another way of kind of putting that same share. So seek their patient's participation, help them to explore their options, assess the values and preferences, reach the decision with your patient, and then continue to reevaluate. And the goal is really to be empowering our patients to help take care. The concept of adopting kind of this omnichannel interactions with hemophilia care really is referring to using multiple modes or multiple ways to communicate with patients to provide them with seamless and smooth care services. Really is targeting that patient engagement, satisfaction, access to care, and ideally is really helping especially underserved populations. There are other advantages looking at cost savings, adherence to regimens, and hopefully is helping to enhance that coordination among providers and patients. And so really trying to get at improved patient care, improved team productivity, and really working together as one group with the patient.
All right.
So we do have these 4 cases at the end, and I know we only have a few minutes, so just to kind of quickly think through them. We have an 18-year-old patient with severe hemophilia A who has recurrent ankle bleeds and is averse to IV administration. So this is somebody that sounds like they enjoy music and video games, typical at 18-year-old, but doesn't take their factor VIII concentrates, has attempted the standard half-life and previous generations of extended half-life therapies. So, thinking of, could newer agents fit in here? What are some of the options that we could do? I think if we move to the next one, if you just think about something like a 20-year-old patient, severe hemophilia A, this is somebody that's active in sports, and is on Altuviiio, which are once weekly IV infusions. You know, they were previously needing 3 times a week infusions, sometimes every other day when they were during basketball season. And sounds like they've considered non-factor therapies, but is active and is concerned about, is it going to give me the same types of effective coverage and bleed prevention? If we move to the hemophilia B world, I've got a case of a 10-year-old boy. If you think about, this is a patient with severe hemophilia B that is complicated by anaphylaxis, has had a high titer inhibitor, required daily Novo-7 or activated factor 7 prophylaxis through a central line, continues to have recurrent joint bleeding despite relatively good adherence to daily prophylaxis, but obviously frustrated that, thinking about the options, the lack of treatment, the ongoing bleeding despite this, very burdensome treatment strategy, and thinking that is this where some of these newer agents may be able to come into play. And then finally, a 15-year-old boy with severe hemophilia B who's been on routine prophylaxis with extended half-life factor products, but continues to have several major knee bleeds resulting in with joint arthropathy, is an active varsity basketball player. He's tried increasing prophylaxis, but he just struggles with the adherence with a busy schedule. Doesn't do his own infusions, so relies on mom still to do his IV infusions, but he's disappointed when he misses out on games for bleeds, and he's embarrassed by the knee swelling, so is kind of open to thinking about, this is one of those areas that you might consider some of these newer agents. Yeah, so first patient per minute or so.
Sure. So I mean, I think this patient is one that we made a switch actually to him using imicizumab, so one of the factor VIII mimetics. It's been on the market the longest, and he ended up being a good candidate for that. He wasn't quite as particularly active as some of the other patients that we talked about in sports, and really his intravenous infusions was the big problem for him. So the fact that there's subcutaneously available products now really is a good option for him. And I think certainly with concizumab, marstazumab coming on the market now, 2 other options that potentially, if he wanted to try something else, certainly any of those could be potential options for him in that regard, and provide him good hemostatic coverage.
And I think if we think about this as like a transitioning period where patients are thinking about like leaving home and leaving the comfort of mom and dad being available to help, I think this is where that shared decision making comes in with this age group especially, and really trying to think about what's important to them, how busy are they going to be if they're going away to college or whatnot.
Absolutely. Yeah, and the second patient, this is one who really, as we were talking about the treatment burden with some of those, the standard half-life factors, is infusing 3 times per week and sometimes every other day with basketball season, was really concerned about having like the most normal hemostatic coverage as possible. And so actually when, more recently, again, past few years, once a week long-acting factor VIII or Altuviiio is available. And so having higher sustained factor VIII levels was important for him. Now, he wasn't as concerned about the intravenous administration, so subcutaneous wasn't something he particularly desired, but certainly the reduced treatment burden with higher factor levels was something he was considering. Another thing that could potentially be an option for him would be gene therapy. That is something that, is licensed for adults with hemophilia A, and talking with him, that's something that he's considering. but right now is kind of in the watch and wait and see how some of the clinical trial data emerges before he maybe takes the jump and decides to try gene therapy. Or, as we were mentioning, this potentially with gene therapy could be a once in a lifetime trial. As there's other products that are investigations, some patients too are choosing to wait and see what else will be available in the next few years if they're really going to decide to jump in and do it. In the meantime, once weekly, sustained factor VIII activity is working for him with Altuvio. So.
Yeah, I think it's great that there's so many options. For these hemophilia B cases, I think when we think about hemophilia B with inhibitors, it's a small category of our patients, but it is the category of patients that really are in such need for good prophylaxis. And so, really looking at these anti-tissue factor pathway inhibitor products, have been are a welcome option for patients. So with concizumab available now for the daily injections, I think this is definitely something that this patient and the family would be interested in at least considering just trying for that better prophylaxis. As other products like the fitusiran product, comes hopefully to market soon, it's going to be a nice option to really weigh what the dosing regimens and the frequency and whether you want the lab monitoring and those types of things. There's going to be some options of product choices for them, but hopefully offering, again, just that improved prophylaxis and improved burden of care. We want to be able to help with that. And in this situation for, the teenager that's active in sports is his life, continues to have bleeding, just really this highlights that, there are still troubles that we have with factor, even with good factor prophylaxis. And so this is something that, he doesn't do his own infusions. It's hard to do more than what we're asking. And so thinking about a different strategy. So thinking about the sub-Q options that he can learn to do better on his own. This is somebody that, he's too young for gene therapy right now, but maybe in a few years from now, they might really consider it. So, talking in advance now for some of these newer options, I think, is an exciting time for them.
Very, very true.
So I think, I know I apologize that we went a few minutes over, but really, and we will address these questions quickly, but, there's several new approaches and different mechanisms of actions that are now available between the extended half-life factor mimetics, rebalancing agents, gene therapies. It's really have evolved into this individualized patient care, and it's important for patients to understand the risk and benefits of the therapies and the potential clinical utility. Patients and clinicians also need to understand the difference and how well, patients can do on prophylaxis compared certainly to on-demand treatment strategies, but even for those that are on prophylaxis and, targeting different values that they may have in their current stage of life. So,
absolutely.
So we did see a question. So one of the first questions that was on here, there was any ideas on encouraging patients about being proactive instead of reactive? I think one of the things that I always think about is if you can find something that motivates the patient. So, like the patients that are active in sports, that's a motivation for them to not have bleeding if they want to continue activity. So if you can find some motivating factor, that can be helpful. I don't know, Jonathan, if you have...
Yeah, absolutely. I mean, I think it's really important to look and see what goals do they have in their life, and then how can we think about them achieving the different things that they want to do. Maybe it's improving their mental health by having a reduced treatment burden. So we want to help them with that. If it's more along the lines of increased hemostatic potential for they want to do a new weightlifting routine, or maybe they're having joint pain and they want to be able to get down on the floor and play with their young kids. You got to find something to really have the patient understand the value for preventing bleeds versus just being reactive and treating bleeds when they occur, and also looking at the benefit of long-term joint health. So I think there's a couple other questions we want to address too. One of them, speaking of joint health, is there evidence for joint improvements on new agents? So that is something that's definitely being looked at. I think one caveat with that is that we have limited data from some of these early clinical trials. So really, we're going to need some more longitudinal data as this gets into the real world. And, a lot of the early clinical trials are really just looking at annualized bleed rate and bleed prevention, and really just showing, is it safe? Is it efficacious? Do the dose, that the earlier phase trials showed, do they work? And so that's really the early data. Now, there are follow-up studies to these new agents where I believe, all of the companies are looking at long-term joint health, because that's a huge area of need and understanding in basically all the agents that are available, whether it's factor, non-factor, gene therapy. So I think more to come. I think I would wait and see, how joints fare with kind of that constant thrombin generation. I don't know, Mindy, if you have any other comments to that.
I think, figuring out kind of how to measure and what are we looking for in joint changes. So most of us are doing with the HJHS that you saw, that's the hemophilia joint health score, and looking for changes, but sometimes changes take time. And so it is one of those that kind of more long-term types of information we're looking for. One of these questions was, is there evidence of increased participation in sports with new agents? I think, is this, I guess I can read this in two ways. So one, do we think patients are doing more on these new agents? And I think some of that goes to those quality of life and the patient-reported outcome measures, where we're seeing improved quality of life. We're seeing less treatment burden, less hemophilia burden, that would likely allow them to participate in more of those things. So I don't know. Most of the original studies didn't really look at activity levels per se, but we're more so looking at the kind of reported outcomes. So more to come, I think, on that part as well.
Absolutely. Yeah, another question here. How healthy does the liver have to be to receive gene therapy? Excellent question. Really, it's recommended that patients be evaluated by a hepatologist for liver health prior to consideration. There is the additional caveat that patients are asked to abstain from alcohol, usually at least for a year if they're going to do this. And so, and then in moderation beyond that. So I think that's another thing that, you got to think about. If you're transducing the genetic material into these hepatocytes, you want to basically protect them at all costs, right? Because if something happens to them, if they either are affected by the immune response or they're damaged through whatever means, that population of liver cells could go away, right? So if you want sustained expression, that's important. And certainly pre-existing liver disease is a challenge for some patients who have maybe pre-existing HIV or hepatitis C. And right now, gene therapy trials have variably looked at those as potentially exclusionary or not. And when it gets in the real world, those will be things that we need to better understand. But the short answer is having a normal, healthy liver is definitely gives you the best chances of having a positive outcome with gene therapy. As we mentioned, some of the immunogenicity that is being worked on and less understood can sometimes be more of a challenge with maintaining, gene expression long term. And I think a final question we have, and certainly, I think we'll take more questions if they come up. Are novel agents recommended among patients with adherence issues? I think that is a universal problem. Yes, I mean, I think prophylaxis is recommended in general, right, for patients that have ongoing bleeding concerns. But certainly some of these innovations have been developed to try to improve adherence, right? If you're doing things once a week or subcutaneous, those would be advantages potentially of some of the rebalancing agents, gene therapy, and things we talked about. I don't know, again, Mindy, if you have other thoughts on that.
I think this is where we've tried to work on some strategies. So, I think many of us have patients that we struggle with some adherence where sometimes maybe this once a month treatment, or sometimes potentially even less in the future.
Right.
Maybe that's something that patients will come to clinic for that then, instead of relying on them doing it at home. That's something that, we can help with that. So I think there's, with the flexibility in the dosing schedules that come with a lot of these newer agents, we are able to kind of work with patients and try to figure out what are the barriers to their adherence, and is there a product that might fit better for them. Nothing's perfect, but
Right.
there are some more options.
Yeah, absolutely. Good. All right.
Not that we really appreciate everybody's participation tonight, and thank you again for the questions, the polling, and obviously your attention and interest in this.
Absolutely.
Thank you for joining us in this final episode of Talking Hemophilia, Patient Perspective in Hemophilia Care. Please return to the landing page to access the downloadable slides and other related topics.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.